Welcome to Dr. Mai, sharing medical knowledge. Today, we're diving into a topic that many of you might have experienced but may not fully understand: wheezing. This article will cover everything you need to know about wheezing, from its causes and symptoms to treatments and when to seek medical help. If you find this information helpful, don't forget to subscribe to our channel, like, and comment below to support our community and encourage more content like this. What is wheezing? Wheezing is a high-pitched whistling or rattling sound that occurs when you breathe, usually more noticeable when you exhale. It happens when your airways are partially blocked or narrowed, making it difficult for air to flow freely. This can be caused by various factors, including medical conditions like asthma, infections, or even something as simple as breathing in dust. While wheezing can sometimes be a minor issue that resolves on its own, it can also be a symptom of a more serious condition that requires medical attention. Understanding the potential causes of wheezing and knowing when to seek help can be crucial for your health. What does wheezing sound like? Wheezing can vary in sound and severity. Some wheezes are only detectable with a stethoscope, while others are loud enough to be heard without medical equipment. The tone and pitch of the wheeze can also vary depending on the location and cause of the obstruction in your respiratory system. Upper airway wheezing, a hoarser, deeper sound, often likened to a stridor, which may indicate issues with the trachea or vocal cords. Lower airway wheezing, a more musical, high-pitched sound similar to a wind instrument like a clarinet, often associated with conditions affecting the smaller bronchial tubes, such as asthma or bronchitis. How common is wheezing? Wheezing is a common symptom that can affect anyone, from infants to older adults. However, some groups are more prone to experiencing wheezing. Infants and children. Up to 30% of infants may experience wheezing in their first year due to their smaller airways and increased susceptibility to viral infections. Adults. People with chronic conditions like asthma, chronic obstructive pulmonary disease, COPD, and heart failure are more likely to wheeze. Smokers and those exposed to lung irritants are also at higher risk. Possible causes of wheezing. Wheezing can be caused by a variety of factors, ranging from relatively minor conditions to serious health issues. Here are some of the most common causes. Lung issues. Asthma, a chronic condition characterized by inflammation and narrowing of the bronchial tubes, often triggered by allergens, exercise, or infections. 2. Bronchitis, inflammation of the lining of the bronchial tubes, which can cause wheezing along with coughing and mucus production. 3. Chronic obstructive pulmonary disease, COPD, a group of lung diseases, including emphysema and chronic bronchitis, often caused by smoking, leading to persistent wheezing. 4. Pneumonia, an infection that inflames the air sacs in one or both lungs, potentially causing wheezing, especially in young children and older adults. 5. Cystic fibrosis, a genetic disorder that causes thick mucus to build up in the lungs, leading to wheezing and difficulty breathing. Vocal cord issues, vocal cord dysfunction, VCD, a condition where the vocal cords do not open properly, causing wheezing, shortness of breath, and a feeling of tightness in the throat. Digestive tract issues, gastroesophageal reflux disease, GERD. Chronic acid reflux can irritate the airways, leading to wheezing, especially when lying down or after eating. Allergies and anaphylaxis. Allergies. Exposure to allergens like pollen, dust, or pet dander can cause wheezing in individuals with allergic asthma. 2. Anaphylaxis. A severe, life-threatening allergic reaction that can cause sudden wheezing, swelling, and difficulty breathing. Immediate medical attention is required. Heart conditions. Heart failure. Fluid accumulation in the lungs due to heart failure can cause wheezing, known as cardiac asthma. Lifestyle factors. Smoking. Smoking or exposure to secondhand smoke can irritate the airways, leading to chronic wheezing. 2. Medications. Some medications, such as non-steroidal anti-inflammatory drugs or beta blockers, may cause or worsen wheezing in sensitive individuals. Diagnosing the cause of wheezing. If you or a loved one experience persistent or severe wheezing, it's essential to consult a healthcare provider for an accurate diagnosis. Your provider may ask about your medical history, perform a physical exam, and use the following diagnostic tests. Pulse oximetry, a non-invasive test that measures oxygen levels in your blood using a sensor on your finger. Chest X-ray, imaging to check for lung conditions like pneumonia or COPD. Pulmonary function tests, tests that measure how well your lungs are working. Blood tests, to check for infections or other underlying conditions. Treatment options for wheezing. The treatment for wheezing depends on its underlying cause. Here are some common treatment approaches. Asthma medications. Inhalers. Quick relief inhalers like albuterol open the airways, while long-term control inhalers reduce inflammation. 2. Glucotrine modifiers. Oral medications like montelukast help prevent asthma attacks and reduce wheezing. Bronchitis treatments. Bronchodilators. Medications like albuterol can help open airways and improve breathing. 2. Antibiotics. If the bronchitis is bacterial, antibiotics may be prescribed. GERD treatments. Antacids and proton pump inhibitors. Medications that reduce stomach acid can help prevent acid reflux and associated wheezing. Lifestyle modifications. Smoking cessation. Quitting smoking can significantly reduce wheezing and improve overall lung health. 2. Avoiding triggers. Identifying and avoiding allergens or irritants can help prevent wheezing episodes. Over-the-counter remedies for wheezing. While OTC medications may not cure the underlying cause of wheezing, some home remedies can help alleviate symptoms. 1. Breathing exercises. Diaphragmatic breathing can help relax the airways and improve lung capacity. 2. Hot herbal tea. The warmth and steam can soothe the bronchial tubes, and certain teas like green tea have anti-inflammatory. 3. Humidifiers. Adding moisture to the air can help ease breathing, especially in dry environments. 4. Air purifiers. HEPA filters can remove allergens from your home, reducing the risk of wheezing for those with allergies. When to see a doctor. You should see a healthcare provider if your wheezing is new, persistent, or associated with other concerning symptoms such as shortness of breath, chest pain or tightness, swelling of the lips or tongue, bluish tint around the mouth or fingertips, confusion or altered mental state. When to seek emergency help. Seek immediate medical attention or go to the emergency room if you're having difficulty breathing or can't catch your breath. Your skin, lips, or nails are turning blue, indicating a lack of oxygen. You start wheezing suddenly after a bee sting, eating a new food, or taking a new medication, which could indicate anaphylaxis. A note from Dr. Mai. Hearing a wheeze from yourself or a loved one can be alarming, but it's not always a reason to panic. While wheezing can be a temporary reaction to a cold or allergy, it can also be a symptom of a more serious underlying condition that requires medical attention. Knowing the causes and recognizing the signs of when to seek help can make a significant difference in managing this symptom effectively. Remember to follow your healthcare provider's advice, avoid triggers like smoke or allergens, and maintain a healthy lifestyle to keep your airways clear. Thank you for joining us on this deep dive into the world of wheezing. If you found this information useful, please subscribe to our channel, like this video, and leave a comment below to support our mission of sharing medical knowledge with the world. Stay healthy, stay informed, and we'll see you in the next video.